My name is Dr. Trudy Ufondu of Snowspirations, Global Health Solutions. Thank you so much and welcome to today's clinic. Remember that every Sunday, normally about 5 p.m. Nigerian time, we normally host a clinic titled Maternal and Child Health Clinic every Sunday. So my name is Dr. Trudy Ufondu. I'm the convener of Snowspirations, Global Health Solutions, and it's a big privilege and it's a very big pleasure to be your host this evening. We're going to talk about the fallopian tubes. We're going to talk about the possibility of achieving pregnancy when you have blocked fallopian tubes. So as soon as possible, when you come in, please indicate where you're tuning in from. I'm located in Tampa, Florida, in US. And thank you so much for coming. Today is the second day of the new month of May. May is going to be a month of multiples. So anywhere you see M, it's multiples. So the month of May is going to be a month of multiple pregnancy. So we're going to walk the walk with you in our group to ensure you understand how you can achieve multiple pregnancy. In the past, we've taught this class, but this is going to be a different approach. We're going to have a round table approach of multiple pregnancy. So you're going to have an opportunity to look at your options, to look at the various ways you can end infertility and end infertility on a higher note. So keep in touch with us. We're going to release the details soon, but it's a very big event you don't want to miss. It's once in a year. So this year is going to be on multiple pregnancy. Remember that multiple pregnancy is a situation where instead of having one baby, you're going to have two, you're going to have three, you're going to have four at a sitting. Someone is going to have that experience. Someone might likely think it's all over, then you take your bold step, and before you blink, you're a mother of two, you're a mother of three, you're a mother of four. It is possible, especially if you're older. So older women have an advantage of having multiple pregnancy compared to younger women for the simple reason of God's design. So God designed the eggs to kind of be more active when you're getting older. So in some women, instead of releasing one egg, they will release more than one egg. In some women, when they go for IVF, they will succeed in having twins. So your possibility of ending your infertility as a multiple pregnant mother, as a twin mother, as a triplet mother, as a quadruplet mother, it's higher, above 35. So you can succeed in becoming a mother of more than one baby. But this evening, we're going to talk about the tubes. And as soon as I have my magic number, which is 50, I'm going to start the clinic. Now, remember, we have different ways you can approach and enjoy the group free of charge. Number one, my timeline. So if you're in my timeline now, you can see me live and direct. If you're in my health group, SGHS Health Club, you can see me live and direct. If you're in our page, you can see me live and direct. If you're in YouTube, you can also see me live and direct. So we have 4 different platforms. Now, majority of our members are in the page. Few people are in the group. Very tiny population are in YouTube. We are in YouTube. We are also in Instagram. We haven't set up the Instagram account, but it's gonna, pretty much come live so that anytime I go live, whichever platform you choose, you will see me there and you will have opportunity to ask your questions. But this evening, let's talk about the fallopian tubes. You see, the way God designed the body of a woman, God designed the body of a woman in such a way that there are specific roles for specific structures in the body in regards to having a baby. Of all the structures in the body towards pregnancy, the tube, it's pretty much the most important because you can produce the eggs from the ovaries, you can produce the sperm from the testes, but unfortunately, if both of them cannot meet and come back and implant in the womb, you can become pregnant naturally. Thankfully, with the advent of modern technology, there are a couple of things we can do to still enable you to become a mother, despite the fact you might have blocked tubes. But here are the facts. For you to become pregnant naturally, you need at least one healthy open tube. So every woman has one left tube, one right tube. So you have two different tubes. The reason why God made it in such a way to have two is to compensate. So if the left is blocked and the right is open, you can still become pregnant, including having twins. So what you need as a woman to have the opportunity of achieving pregnancy naturally is one tube. So if one is damaged and the other one is open, you can become pregnant naturally. Remember, there are so many ways you can achieve pregnancy. It's not only through the natural means. When you can't succeed in becoming pregnant through the natural means, we have to look for artificial means. Artificial means is under one umbrella. It's called artificial or assisted reproductive techniques. There are so many types of assisted reproductive techniques. It can be through fertility treatment. It can be through IUI. It can be through IVF. It can be through donor egg. It can be through donor sperm. It can be through surrogacy. And also adoption is in the bigger spectrum. So you can become a mother. You can become a father through any of the means I mentioned. But this afternoon, we're talking about damaged tubes. So if for some reason your tubes got damaged, the commonest thing that can damage your tube is what we call PID, pelvic inflammatory disease. Now, the commonest thing that can lead to PID, two bacteria, which you can pick from sexually transmitted means, chlamydia or gonorrhea. Now, it doesn't mean that all PIDs are caused by chlamydia or gonorrhea. There are a couple of other things you might be predisposed to which can damage your tubes, but the commonest is PID. So if you have infections growing up, when you recently started, having sexual contact, don't be shy when you notice anything not okay with you. When you have pain, when you have discharge, when you have, pulse, when you have anything you don't understand, don't go and start treating yourself. Make sure you see a gynecologist, especially when you're younger. So a couple of women damage their body growing up because they didn't do the right thing. Then growing up, you develop a couple of things. So if you have chronic pelvic inflammatory disease, chronic PID, they love the tubes. So they can go to your tubes and be damaging your tubes gradually. Then over time, your tubes are gonna be blocked. Your tubes can be blocked. And when it's blocked, it can form what we call adhesions or scar tissues. Now, these are the things that can stop you from becoming pregnant. That's number one. Then there are a couple of other things that can damage your tubes. If you've had surgery in the past, if you've had womb infection, if you've had tubal infection, or if you have endometriosis, or if you have very humongous fibroids, these are factors that can block your tubes. Let me give you an example. If you have a very big fibroid occupying a substantive space in your womb, they can grow so big to go up and block your tubes. When this happens, your tubes are not going to function properly. Now, some people will be wondering, is it possible to still, get pregnant when your tubes are blocked? Or what can you do to unblock the tubes? Now, this is where you need to be careful. It's possible to unblock the tube temporarily. So there are a couple of surgical procedures in a very, very experienced background we can use. If they have the facilities, we can carefully go into your womb, carefully get to the tube and dislodge that blockage. Unfortunately, the tubes are very sensitive. So you can succeed in unblocking the tube temporarily. Within that period, your tube succeeded in getting unblocked temporarily, you have to get pregnant. Because over time, your tubes are gonna develop adhesions again. So in essence, your tubes are very, very sensitive. So sometimes, in course of trying to correct the problem in the tubes, we will create more problems. So when we're operating on the tubes to remove the adhesions, if you don't become pregnant within a stipulated time, that tube is going to gradually develop adhesions, gradually develop scar tissues. And when that happens, the opportunity for you to become pregnant will be limited. So the question of unblocking your tube, is it possible? Yes. But it has to be done by a micro-invasive surgeon who will time everything. So in some women, they can use a combination of IUI. IUI is intrauterine insemination, which is also called artificial insemination. So in IUI, we're going to time the person's sperm, right? We're going to get what we call washed, prepared sperm. We're going to get it through a catheter. Then we're going to introduce it into the vagina, through the cervix, and drop it in the womb. The idea is to help the transit time to get the sperm to the womb, so that once it gets to the womb, it can begin its journey to find the right tube. Thankfully, what you need to become a woman is your ovary. So even if the left tube is damaged, but the left ovary is still producing eggs, those eggs in that left ovary can still be produced, and through some floating structures in the body can go and enter through the right one. So what you need, in essence, to become a woman is your ovaries. So long as you have functional ovaries, you can become pregnant. So the pregnancy can be through you, or the pregnancy can be through another person through the process of surrogacy. So in surrogacy, for some reason, your womb is not going to carry your baby. For some reason, your womb is incapable of carrying your womb. What do? We're going to use your eggs. We're going to find another woman. We're going to use your partner's sperm. We're going to use your own eggs. So it's more like doing IVF in another lady. So we collect your eggs, we collect your partner's sperm, then we look for a second person to carry your baby. Unfortunately, some women are going to use this. There is nothing wrong in it. Even if it means using donor egg or using donor sperm, there is absolutely nothing wrong in it. You have to use what you have. You have to use your best options if you're having problems, okay? So when your tubes are damaged, the key thing is to know the diagnosis and start on time. If we can correct it, you can have a chance. Now, this is where you need to be careful. Unfortunately, some providers will tell you to keep coming for flushing. They want to flush your tubes. You've been flushing your tubes for 10 years. My sister, listen to me. If your tubes are fully blocked, if your tubes are completely blocked and severely blocked, no amount of flushing is going to open it. You're wasting your time. Now, can you become pregnant in a blocked tube? In some situations, you can, but it can be deadly. Let me explain. If the blockage is not from the proximal end, so if the blockage is not coming from the side of the ovary, because when the eggs are released, they will enter through that side of the tube. When the sperm is coming in, they will enter through the side of the womb. Now, if the sperm can come in and the eggs can come in, and fertilization occurs, but somehow within that time frame that the fertilized egg, which is now called an embryo, is supposed to go back and implant in the womb, which is called implantation, it will be arrested in the tube. When this happens, pregnancy will start developing in the tube. Naturally, pregnancy is not meant to be developing in the tube. Your tube is not strong enough to support pregnancy. So in that situation, you're going to have what we call ectopic pregnancy. It's a very deadly emergency. It can kill you. So when we diagnose ectopic pregnancy, what do? We're going to stop that pregnancy. We are going to cut off that tube because the tube is as good as nothing. So this is the danger of becoming pregnant with blocked tubes. So some women can actually succeed in becoming pregnant with the blocked tubes, but when that happens, pregnancy will start developing in the tube, and that's a very big danger. Some women have died from ectopic pregnancy. It's really, really terrible. You do not want to have that. And unfortunately, when you have ectopic pregnancy, they will remove that part of the tube. So you go for what we call salpingectomy. We remove that tube. Then you now have only one tube remaining, and you can still become pregnant with one tube remaining. But you have to know your choice. So the point I'm making this afternoon, my sister, it's possible they've told you your tubes are blocked. Okay? It's not just good enough to tell you that your tubes are blocked. We need to know how. We need to know the extent. So is it severely blocked? Is it mildly blocked? Is it moderately blocked? If you have mild blockage, when you go for the investigation that can tell us if your tubes are open or not, which is called HSG, hysterosalpingogram, is a special type of X-ray we use in checking the tubes and the womb. So if you have mild blockage, it's just like, you're sweeping your house and you saw some cobwebs, you can sweep them off. So in some women, when they go for HSG, the HSG procedure can open those mild blockage. Matter of fact, we have noticed that women that go for HSG have improved fertility, because at some point in your body, there are a couple of things that might block your tube. So when you go for HSG, the fluid which you're using doing HSG can flush a tube that is mildly blocked. In some other women, if their tube is moderately blocked, that means in the middle, they can benefit from the hydrotubation, which is called the flushing, possibly. But if your tubes are completely blocked, if we have the facility to do what we call canalization, that means opening, dislodging that blocked tube within a temporal period, you can succeed in unblocking a blocked tube. Then within that time, we unblock it, you have to get pregnant, because over time, the tube is going to close again. But if unfortunately the two tubes are blocked, if you're so unfortunate, but remember in life, where you have unfortunate situation, there are fortunate things there. So the fact your two tubes are blocked doesn't mean it's the end of the world. You can still become pregnant, but you need to go through IVF. So when your two tubes are blocked, the natural rule of your tubes are not going to happen. So what do? We collect the eggs, we collect the sperm, we join both of them together outside the body of the woman. Then when it's ready, we put it back inside the woman. So you can still become a mother when one tube is damaged. You can still become a mother when two tubes are damaged. Unfortunately, IVF is expensive, but this is your best option, my sister. So stop wasting the money you don't have. Stop going to places that will raise your hopes, but the problem you have is your tube. That's the way it is. You need to take your chances. So if you're listening to me this afternoon, if your tubes are blocked, you need to go and shop for money and get your IVF started. You need to go and start thinking about adoption. You need to start thinking about different options, because whichever way you're going to be a mother, it doesn't matter how. And I understand that money is involved. Unfortunately, it's expensive, but don't allow money stop you from starting your family. Your family is way, way bigger than money. So if you have to get that money anyhow, get the money and start your family. The earlier you do this, the better. The most important priority in your life is to start your family. So if you need help in these regards, if you need to talk to me personally, if you need to subscribe, admin is going to set you up. And if you're in the locations I'm going to mention, you can actually get a referral from me. So if you're in Abuja, if you're in Asaba, if you're in Oka, if you're in Benue, if you're in Calabar, if you're in Enugu, if you're in Jos, if you're in Kano, if you're in Newi, if you're in Oshun, if you're in Owerri, if you're in Poraka, I can refer you. Now, if you're not in the locations I mentioned, but you live close, you can still go there. People still take off from America to go to Nigeria for their procedure. So don't allow distance stop you. Now, it's possible that your partner might be in America or UK or Canada and you're in Nigeria for some reason. He's having immigration problems. You can also become pregnant. You need to talk to a fertility specialist. There's a way we can get the guy's sperm down to Nigeria and use your eggs, and you can go for your IVF. So distance should no longer be a problem. In the same vein, there are a couple of facilities they can also use to transport someone's sperm from Nigeria to the other side where they can get you started. So it doesn't matter what the problem is. What matters is the solution, and we are solution oriented. So the answer is yes. Your partner can transport his semen back to the fertility specialist. They can freeze it and you can become pregnant. I recently have a client in Warri who the husband is outside the country, and she's been attending my teachings, and she imbibed my advice. And when the partner came back, I think last December, they both went to a fertility specialist. They froze his sperm. And when they wanted to go for IVF, it was those frozen sperm that they used. So your partner, when your partner is coming back and he's not going to come back for a long time, you guys can go to a fertility specialist. We can get the sperm, we can freeze the sperm, we can store the sperm, and we can use it subsequently. Now, there are some men that have sperm in different places all over the world. You can still use that. The same thing can happen to the eggs. Some people have embryos. There are some women that probably, because of some factors, the embryos and the eggs they have, they can't use it. So guess what? Let me explain this, because there are a couple of things some people don't understand. So there are some good people out there. Now, if you're going for IVF and you're young, relatively young, and we got a lot of eggs, those eggs are going to be stored. Now, when we are doing the embryo generation, which is getting the sperm and the egg together, then we have a couple of embryos. The remnants of your eggs, the remnants of your embryo can be donated to other people. So that's the concept of donor eggs. That's the concept of donor embryo. So it can be donated. In some situations, you can use it for research. So you can tell the place that store the eggs or the sperm or the embryo to use it for research, or you can tell them to use it to donate to other people. So these are possibilities. Thank God for modern technology. Now, the only thing you need to become a mother, it's a heart of a mother. If you have a heart of a mother, you'll become a mother. But if you want to figure things out, there are so many things you can't figure out. And if you're not careful, you're going to end your life alone. Okay, so that's my quick teaching about this tubal issue. And I'm going to give you an opportunity to ask me questions. So please go ahead and ask your questions. The clinic is going to open now, and admin is going to moderate. So focus on the admin. If you need any help, if you have any things you want to clarify, this is an opportunity, but the clinic is going to open now, and I'm going to quickly take care of your questions. So let me see what I have. Okay, guys, let's see. If you have questions, please go ahead and ask. If you're going through this challenge, let's have a frank talk about it so you can get the help you need. I wouldn't want you to spend the rest of 2021 moving from one place to the other, flushing a tube that is blocked. Let's talk about it, okay? And you need to take your bold steps after today. Okay, so guys, let me see what I have. Please ask your questions. In the next about 10 minutes, I'm going to wrap up. Tomorrow is Monday, and I have a lot of things doing. So ask your questions in the next 10 minutes. Open questions, straightforward questions. Admin, if there is any question I didn't see, you can copy and paste so I can provide feedbacks to them, okay? But guys, this is an opportunity. When you've introduced yourself, let me know where you're located. As soon as possible, start asking your questions, please. Start asking your questions, please. I know it's very late in Nigeria. It should be getting to 11:30. I understand that, but I wanted to keep to my promise. That's why I'm still showing up. It's been a very busy day. But guys, this is time for questions. Please ask your questions. I'm not seeing any questions yet. If you have any questions, if you have any concerns, if you have any clarifications. Okay, someone is asking about tuboplasty. So tuboplasty simply means corrective surgery we do in the tubes. So like the surgery I told you about, canalization. So any damage in the tube, any procedure we're going to do in the tube is called plasty. Anytime you're going in to make surgery to correct anything, is called plasty. So tuboplasty is a special surgery of checking your tubes, of reconstructing it, of making it to look cool, to have that opportunity of becoming a mother. But unfortunately, it's only in few centers, few advanced centers. That's the only place you can go for any surgery in the tube. The tube is very sensitive in the sense that when you're trying to go and correct something there, you cause more problems. Okay? Do you have any clinic that can transport sperm to? I don't have that information. What I can do for you, when you subscribe, I can set you up with a provider in Nigeria and you can have that conversation. My provider in Abuja can provide you that services. Okay? So guys, ask your questions, please. Ask your questions. If you need to consult with me about your own personal case, admin is going to set you up. You have different categories. You have 1 week, you have 1 month, you have 3 months, you have 6 months. Whichever one you can afford, come in. Now, if you are already pregnant, please, we also have a special group for pregnant women. It's called our SGHS ANC Lounge. You will go there, you will interact with other pregnant women, you will have opportunity to interface with us every single day. If you are also believing to become a mother, which is going to happen sooner than you know it, we also have a lounge, which we call Believing for Baby Lounge in Telegram. Now, those are the 2 group consults. You would have to have Telegram. Telegram is a social media platform where you can also interact with people. So that's the criteria for going for that group consult. But if you need one-on-one consult, you can come in at light. Light is 1 week. You can come in at basic for 1 month. You can come in at classic. Classic is for 3 months. Or you can come in at prime. Prime is for 6 months. Of all the packages, the one I will advise you to go for is the prime. Why? When you go for prime, you have more time and you can have a talking time with me. Okay? Guys, ask your questions. Ask your questions so I can provide you feedbacks. Okay? Thank you for coming. Kelechi from Owerri, Ifi from Kaduna, and Ifi from Lagos. Thank you guys for coming. I know it's very late in your location, but thank you so much for making our time to attend. But guys, it's question time. I still have about 44 people watching. So guys, ask your questions. Okay. If you need to subscribe, follow my admin. My admin is doing an amazing job. She's sending all the details you need. So you can actually subscribe directly, or you can shoot us an email. Then if you're having challenges, we can set you up. What's the major cause of tubal blockage? PID, pelvic inflammatory disease. Pelvic inflammatory disease, the major cause of pelvic inflammatory disease is poorly treated sexually transmitted infections. 2 types, chlamydia and gonorrhea. So when it's poorly treated or completely untreated, they can be in your body. So this is where you need to be wise. In case of making love with so many people, you might pick up itching, infection, discharge, pain, and over time you won't have them. You'll think you've taken care of them, especially if you abuse a lot of antibiotics, but you haven't treated them properly. The good thing about chlamydia and gonorrhea, they are bacterial infection. If we identify them, we can completely take care of them. But if we don't identify them on time, they love the tubes. They can go there and damage your tubes and stay there and cause pelvic inflammatory disease. It can be a painful condition. It can come with different things. It can come with pus. It can come with scarring. It can damage a lot of things in your body. So the earlier we treat it, the better, okay? All right, guys. How long does IVF process take? So everything is going to be dependent on how you responded. So the key factor in the duration of IVF is the response time for the woman and the man. If the guy has good sperm, and the lady has good eggs, and in case of stimulation, the first thing we do is to stimulate the ovaries to produce a lot of eggs. So if you respond well to all the drugs we can give you, it can be done as soon as you blink. Now, if you're not getting good response, because what happens in IVF, we keep giving you injections, we keep checking your ovaries, we keep checking the thickness of your womb, which is called the endometrium, which is very important. For your IVF to succeed, for any pregnancy to succeed, the thickness of the endometrium must be enough to support pregnancy. Unfortunately, in some women, when the thickness of the endometrium is not strong enough, you're going to miscarry. This is the reason why one of the ways of supporting pregnancy is progesterone, because progesterone is the pregnancy maintaining hormone. Okay, so the duration of your IVF is solely dependent on your own individual reaction to all the drugs we are giving you. So some people can go as fast as 3 weeks. Some people, it can be 6 months. And another thing is, there are a couple of things that might be happening as we're getting you ready. Like some people can develop complications. Top on the list is what we call OHSS, ovarian hyperstimulation syndrome. If you have this, we can cancel that cycle and we can start all over. It's better you get it right than to be in a hurry. Now, the major area which you need to be careful if you're going for IVF is what? Quality. So we have to check the quality of your eggs. So we have to do what we call ovarian egg reserve test. That's going to be the determining factor. If you have good eggs, you can use your eggs. But if you don't have good eggs, consider donor eggs. You do not want to use an egg that will fail. It will hurt you so bad. Okay, so guys, ask your questions. What's the best medication to improve your eggs? This is a very wrong question to ask me, my dear. I don't give any medication or drug openly. What you need to do is to see a gynecologist at least. Then we can evaluate your case and treat you on individual basis. Don't form the habit of shopping from this drug medication up and down. That's not helpful. No good doctor will give you any drug over the internet. So what I will advise you to do, if you've already made up your mind to go for IVF, follow the instructions of the doctor that will be taking care of you. They will definitely explain everything for you. But don't form the habit of jumping from one place to the other, trying drugs that people recommend for you. It's not going to help you. It's going to make things worse. Okay? Is there any future disadvantage of using donor X? Well, donor X, when we talk about donor X, it will look like we'll just go and get anybody and begin to give them donor X. No, there are steps. There are checks, there are balances. So first of all, we have to use a younger lady. We have to make sure there is no medical problems, no chronic medical problems, no genetic issues, everything is okay. So it will go through so many scrutiny. We check the genotype, we check the blood group, we do a whole lot of things. We make sure that everything is perfect. But remember, in life, there is no perfection. So everything, let me use the word near perfection, okay? So it's a very careful process. Now, when you talk about disadvantages, going for assisted reproductive technique takes a lot of guts. So it takes a lot of courageous, bold steps. So both of you must understand the concept. It's not a situation where later down the lane, when you guys are quarreling, the man will start using the fact that you used donor X to attack you. Or when your baby comes, instead of loving your baby the way God gave you your baby, you begin to know if it's quality or not quality, or you begin to broadcast your news out there. That's the only disadvantage I can think of. But if you really want to be a mother, if you really want to be a father, there are so many things you don't even need to bother about. The most important thing is that you're going to have a person that will call you a mother for the rest of your life. But if you begin to want to figure a lot of things out, unfortunately, there are certain things you can't figure out. And if you're not careful, you spend the rest of your life alone. Unfortunately, as I'm talking to you guys now, there are some women that if you don't change your ways, if you don't do something different, if you keep doing the same thing you've been doing for the past 10 years, for the past 15 years, unfortunately, my sister, you might end up not becoming a mother. But you can change that story if you want. This is where knowledge is important. Let me give you an example. If you are above 35, you are no longer younger. Your eggs are limited. Now, there is a particular stage you will come to in life. You will enter what we call menopause. When you enter menopause, you've used all your eggs. Now, if your religion, if your culture, if your personal belief is the fact that you don't need anybody's help, because that's exactly what it means, then you're going to spend the rest of your life with your partner. Unfortunately, your partner can still impregnate a woman. So your partner is men somehow have an insurance, because men can still get any woman pregnant. But when you go into menopause, you can still become pregnant, but you need donor eggs. So it's a tough decision, but it's a decision. If I were to be in your situation, I wouldn't even blink. I will go for it immediately. Look, I'm telling you what I would do. I don't know what you're going to do, but my duty is to show you the way. So it doesn't matter how people are. After all, they shouldn't even know. Nobody should even know anything about what you're doing. Nobody should know the details about your infertility. The only three parties should be you, your partner, and your fertility specialist. So if your culture is deceiving you, if your religion is deceiving you, if anybody is deceiving you, better face your reality. This is a soul reality. This is your own world. Sometimes it's not palatable, it's difficult, but this is your reality. So you need to deal with your options. What are the best options? Like for the people that their tubes are blocked, my sister, what are you gonna do? That's a big question. Now, if you don't have sperm, if you have azoospermia, what are you gonna do? If you don't have X, what are you gonna do? So the question is, what are you gonna do? Now, some of us might think we have time. We might be praying, we might be doing a lot of magic, and we are waiting for the appropriate time without knowing that we have to use the time we have and make it perfect. So I'm challenging you to take your bold steps today. Okay? Very, very important. So guys, keep asking your questions. Keep asking your questions. Keep asking your questions. Let me see. Okay. After miscarriage, how long will you stay before trying for pregnancy? First of all, when you've had miscarriage, you need to go back to the doctor. We need to make sure you remove all the remnants of your baby from your body. Then you need to recover. The key word is recovery. You have to recover from that miscarriage. You have to recover emotionally. You have to recover psychologically. Then you have to go back. Your provider will give you a clean bill. It's not good to rush to become pregnant immediately. Okay? You don't have to do that. All right? So that's what you need to do. You need to go back and you go easy. No need to be in a hurry. Okay, guys, do you still have questions? I will take care of 2 more questions, then I'm going to go for the evening. I had intended this to be 30 minutes, so thank you for coming. And if you have any other further question, you can ask. If not, what does reproductive endocrinologist do? So endocrinologist is a special doctor that deals in all hormonal related issues. So a reproductive endocrinologist is someone trained in the aspect of, looking at the issues that come from hormonal dysfunction to correct them. So a reproductive endocrinologist can also go for a fertility specialist. So he's a specially trained doctor that looks into the details in the hormone aspect, because everything that happens in the body is under the control of the hormones. So there are some key hormones which a woman must have in adequate quantity for you to become a mother. Your estrogen, your progesterone, your FSH, your LH, your prolactin, and your TSH. These are the hormones that must be in normal range. If they go up or they come down, you begin to have what we call hormone imbalance. So a reproductive endocrinologist is a specialist in the issue of infertility related to hormonal issues. Okay? All right. What's the cause of failed IVF even with donor eggs? Couple of things. Number one, your age. Okay? Now, sometimes it might be the egg. Sometimes it might be the sperm. Sometimes it might be implantation problem. Sometimes it might be hormonal. Sometimes it might be structural. And sometimes we don't know. So the biggest factor in failure is age and the quality. Unfortunately, even when some people use donor eggs, it's possible that your body is not favorable. It's possible the thickness of the endometrium is not there. So unfortunately, it happens. But when we do everything we can do from the human perspective, you can have a very good chance of having good outcome. Now, some people can go for IVF the first time, it will fail. The second time, it will fail. The third time, if they can succeed, they can have twins. They can have triplets. So it's not guaranteed that once you go for IVF, you're going to have permanent outcome. No, you can fail. Even the best IVF providers, they do have failures. Okay, but the problem is, don't present yourself as a guinea pig. Don't go to someone that doesn't have result. Don't go to someone that doesn't have reputation, especially in this era. Everybody is claiming to be IVF provider, so you need to be careful. Okay? All right. They told you drugs to prevent pregnancy are given to women for about a month before IVF. So here's the deal. Contraceptives, if you attended my teachings a few days ago, contraceptives, which are the drugs we use in stopping you from pregnancy, can be given in course of fertility management. So the answer is yes. Sometimes, in order to regularize your cycle, in order to understand your body better, we use contraceptives to put your body in a state that can give us an opportunity to understand it better. So contraceptives can be used in preparing someone for fertility treatment. So the answer is what? Yes, it can be used. Okay? If you're going for IVF and the male sperm is not of good quality, then you need to use donor sperm. Now, there are some advanced form of IVF, which we call intracytoplasmic sperm injection. That's an advanced form of IVF. So in some men, that might be an added advantage. But if that fails, you go for donor sperm. Okay? All right, guys. Thank you so much. Admin, once you give me a signal to go, I'm going to take my leave and get ready for tomorrow. So thank you for coming. Remember, tomorrow is our Believing for Baby Open Clinic during my break time. So 5 p.m. Nigerian time, come with your questions. And by the grace of God, we're all going to attend to that and you're going to have your chance. Remember, the month of May is for multiple pregnancy. We are going to have a round table. By the grace of God, we're going to have 2 amazing female providers, female doctors of Nigerian extraction, amazing people who can do a lot of things, who have actually been doing a couple of beautiful things globally. We'll have an opportunity to interface with them. This is the first time we're going to have a panel of 2 amazing, intelligent doctors, female doctors. So don't miss that. As the week is unfolding, we're going to be sharing the details. Keep a date. Our events are normally every last Sunday. So if you check, I think the last Sunday should be 30th May. So keep a day with that last Sunday. Don't miss this. There are some women that will start their journey of infertility and suddenly they blink, they become mothers of twins, triplets, and quadruplets, especially if you're older. Okay, thank you so much for coming. And admin, please give me a signal so I can go. Thank you, and take good care of yourself. Remember your PPP. PPP, pray all the time. Play every 48 hours. Playing means lovemaking. Regular lovemaking will get you there before you blink. No matter what the diagnosis is, don't stop lovemaking. Even men that have low sperm count, you actually need to increase your frequency. The fact you have low sperm count doesn't mean you can't get your partner pregnant. You can get your partner pregnant. So admin has given me signal to go. Thank you for coming. If you need help, we can help you. If you need to subscribe, please do subscribe. Now, please make sure you are in our YouTube. Make sure you go there and subscribe. Don't just go there and watch the video. Click on the subscription button. We want to make sure that everybody in all our handles are in the same place so that if anything happens in Facebook, you can always piggyback to your YouTube. You can always piggyback to your Instagram. You know, you have a couple of backups. So admin is going to share the link for our YouTube. Please go there and subscribe. And when you subscribe, like and share. Tell everybody about the good news. Come as you are. Any day you show up, you're going to learn something new. Thank you so much for coming. Please, if you have tubal factor problem, please be decisive about that. If they told you your two tubes are blocked, go and shop for money for IVF. Don't even waste time again flushing a tube that is already blocked. If one of the tubes is blocked, then you need to step up your game. You need to get a fertility specialist. You need to get help so we can use that one open tube to get you pregnant, including achieving multiple pregnancy. So a woman with one healthy tube can still become pregnant, including multiple pregnancy. Okay, thank you so much for coming. I'm going to go now. I'll see you guys tomorrow. Until I see you, God bless you. And admin, thank you so much for moderating. God bless you and enjoy the rest of